Hello, my name is Dr. Kashif Abdullah, and I'm the primary physician at Bay Area Healthcare. We are located at 175 North Jackson Avenue in San Jose, California, and our number is 408-708-7743. Today I was going to discuss contraception, and contraception is a very poignant or needed topic to be discussed in the United States specifically and also elsewhere in the world. And the reason why contraception should be discussed is because of the rates of unintended pregnancies that are occurring in the United States. So, as this graphic shows, 49% of women who became pregnant in the last year, or here specifically 2011, 49% of them were unintended pregnancies. Of those pregnancies, you can see 23% of the pregnancies resulted in unintended births, 21% resulted in elective abortions, and then 5% were fetal losses. So this is something that contraception would help decrease significantly. Um, so what methods do we have for contraception? So we have a variety of methods. Some are do-it-yourselves, and one method that some people use, which is not effective at all, is the basically it's the calendar-based method where people are aware when they ovulate. A woman is aware when she ovulates, and she tries to not have intercourse during that time period. And that's actually that is the poorest form of contraception. 24% of women still become pregnant by using this method, so it's very risky. Condoms, just using condoms alone is still not that great. It's only 18%. Condoms are good for protection against STDs. Don't get me wrong, but you should use condoms should not be the sole method of contraception because there's very high failure rate at 18%. Female condoms are 21%, even worse. Withdrawal is even worse than that at 22%, and the sponge is various. So yeah, 12 to 24%. 12% if a woman has never been pregnant, and 24% if a woman has become pregnant. Um, the more traditional methods one may heard about are the pill at 9%. So even if you're using the pill exactly how it should be used, you still have a 9% chance of having an unintended pregnancy. If injectable such as Depo-Provera, that's still at 6%. So that's not foolproof. Someone might think, oh, it's better than the pill because I just get an injection and I forget about it. Well, no, it's still at 6%. There's still a 6% chance of having an unintended pregnancy. The ring or diaphragm are only 9 and 12%. And the top tier of contraception are one, sterilization. And you can hear male sterilization is very powerful at only 0.15% of women would become pregnant after if their partner has been sterilized or they if themselves have been sterilized 0.5%. Um, I, Remarkably, the best method actually that we have are implantables at 0.5% chance of becoming pregnant. Um, and of course the IUD at 0.2% and 0.8% for the varying kinds. So the best long-term methods of contraception are either implantables, IUDs, or sterilization. So the problem is sterilization is not reversible. That's the biggest. Well, it is reversible, but it's extremely difficult, and it's a surgical. It can be surgically involved depending if it's woman or for a man. Um, it's very difficult to reverse. So an IUD or the implantables are your best bet because they are cost effective and they're rapid reversible. All we do is we just pull them out, and pregnancy does not take that long to start back up. And another thing is they're not abortifactants, meaning they do not cause abortions. They are not going so religious implications are not there with the IUDs. What they do is they prevent the sperm and the egg from fertilizing. They're not going to kill the uh, the fertilized egg. They're basically going to prevent the sterilization. They're going to prevent fertilization from happening in the first place. So the moral and perhaps religious implications are much, much less with IUD and or implants, and implant being the best, honestly. So who can use this? Who can use implants or IUDs? And the answer is just about every single woman of reproductive age can use this very effective, convenient, safe, and reversible form of contraception. The effects can be to a year or longer. Very few contraindications, meaning very few reasons for not having it. People include adolescents, so girls between 18 to 14, 13 if need be, women who've never have been pregnant or have never had a baby, and or patients who estrogens should not be given. This is a very useful form of contraception. So, and then contraindications of who should not be using this. Well, if you're pregnant, obviously you should not be on this. If you have unexplained vaginal bleeding, you should not be using either the implantable or the IUD. Someone who has basically an infection in their blood or who has a pelvic inflammatory disease or an infection involving the uh, female genital tract, of course, should not, of course, be using this. They should be treated for those infections first, of course. Or women who've had breast cancer in the last 5 years, and or if women have fibroids that interfere with placements of IUDs. For them, actually, one could actually use implantable. And then, of course, there's Wilson disease due to copper um, incompatibilities. So, what would you need to do? What tests would need to be done before you can use these? Well, if you look, implantables, no tests are required. No one needs to, you could just go to your doctor's office, he or she implants it, and that's it. You're good to go for basically multiple years with an implantable. The IUDs, a bimanual exam and a cervical inspection. These are very simple things any physician could do. And the backup method are very minor. 7 days backup method being maybe on a pill or using a condom, or basically not having intercourse during those 7 days before the effect fully kicks in. So here's just a summary slide of what I've been discussing, and this is something that we can do in our clinic, especially implantables. I'm trained in implantable forms of contraception. I think that this is a very effective method of contraception that every woman should at least have the option of. A pill is fine, so are Depo-Provera, what have you, but I would highly recommend you using an injectable or an IUD. And if you call us at our clinic at 408 708 7743, I can help discuss methods of contraception. Or if need be, you can just still put messages in the comment section, and I'll answer them. Thank you. All right. Bye bye.